Welcome to another edition of Economic Forum, where we discuss various issues affecting our economy. My name is John Masugu. Today we want to look at different solutions that can be proffered in order to improve our access to good health. And in that vein, we have invited into the studio Professor Colin Masmirembwa, who is a biochemical pharmacologist, who is going to be telling us about some of the research that he has been conducting and some of his views on different issues affecting access to health in Zimbabwe. Professor, welcome to Economic Forum.
Thank you very much.
When we talk about medicines and drugs, at times one does not understand the difference. Is there a difference?
Well, there is a difference. It's just that these words are used interchangeably. So drugs can cover a broader spectrum. It could be beneficial aspects, which are medicines, which are supposed to treat a disease. But some drugs could be chemicals like drugs of abuse, which we are now facing a big challenge, where these compounds or these chemicals are not giving any therapeutic benefit to the person who takes them. So the word drug is more broader, whereas medicine is more specific for trying to intervene in a situation of poor health.
Viewers might ask, why bring Professor Masmirembwa onto Economic Forum? What has drugs and medicine to do with economic development?
Well, the link is quite important, and when you look at what makes a person productive or what makes a person less productive, it is probably the input into the system, into the economic system. And one of the major inputs is a health worker. And when you look at a person who is poor health, they might have absenteeisms at work, and indeed that will result in poor productivity. If you have poor health, your economic productivity is likely to suffer. And a global indicator sometimes for health is the life expectancy. If you look at the life expectancy of people in Zimbabwe, it's around 61 years.
So a lot of us are living in bonus years, is it may be.
You can put it that way. But it means as a nation, we can end up with lower productivity compared to those developed countries. So indeed, even as Zimbabwe aims to be an upper middle income economy by 2030, it would mean that we have to increase our life expectancy from the current 61 and probably up to 65 or 70 years. And I think we should work towards that, because that would be a global indicator of improved health, and indeed it will translate to productivity.
Professor, you made mention of COVID-19, and indeed when it started, there was talk about drugs are still being manufactured, these ones are being tested, the World Health Organization has not approved some of them and so forth. There was that very long period. Where were you?
So when a new disease comes, and the way it did, and in a very aggressive manner, people try to look at existing drugs and see if they can repurpose them. That is, a drug which was being used for malaria, to see whether it is going to work for this particular new disease. And there was a big interest in chloroquine, a drug which was used for malaria. There was also interest in some of the ARVs to see if they could work against the SARS-CoV-2 virus. And so WHO commissioned a number of clinical trials globally. And in Zimbabwe, we were also going to do studies on chloroquine and another aspect of chloroquine called hydroxychloroquine. And we were involved in trying to design this particular study, and our work was important in trying to show that we have a good history of using chloroquine in Zimbabwe. And we know that there are some people who might end up with some kind of side effects to this drug. And we were looking at the genetic profiling of, if this drug was going to work, which patients were we going to give the drug and which ones were we not going to give the drug. So that is the work we did at the African Institute of Biomedical Science and Technology. But unfortunately, chloroquine turned out to be not effective. So did many other drugs which were thought are likely to treat COVID-19. And indeed, fortunately, a vaccine was finally found. And indeed, currently, is the vaccines which are most important in controlling this pandemic.
So in effect, what you are saying is that drugs or medicines have to be suitable to a particular environment. It's not a user fit-all situation.
So that is the area we focus in, and we are normally calling it precision medicine or individualized medicine, where we have now seen that the genetic makeup of individuals makes them respond differently to medicines. One of the works we did in Zimbabwe with the Ministry of Health was that when efavirenz, a drug for HIV, was introduced, so many people suffered neuropsychiatric side effects. They were having nightmares and having, of course, also liver damage and so forth. And we started to worry a lot. We started patients at one of the hospitals, and we were able to show that there's a genetic trait in those people who are more susceptible to the adverse drug reactions. And this work has eventually made WHO recommend a change in the amount of the drug. It used to be given at 600 milligrams, but if you now go to the hospitals and pharmacies, it's being given at 400. So our work managed to convince WHO and other ministries of health to change the dose, and people now are experiencing less side effects. So that is an indicator of you should not give everybody the same dose, and sometimes even the same drug, because some of the drugs will not work in certain individuals, and if they work, they might not work in the same safety margins when given at the same dose.
In the next segment, we shall look at different low-hanging fruits that we need in order to improve our economic development. Probably you can just name them for now, and then we go into greater detail when we get into the second segment. So,
for countries like Zimbabwe and sort of similar countries aiming to improve health, one of the areas we need to work around is increasing the infrastructure for the delivery of health. That's hospitals and clinics, and we also need to increase the quantity and quality of skilled manpower who are going to work in these facilities. And thirdly, we must
not just manpower, but skilled manpower.
Skilled manpower, because it's not good to just have many useless people, but people who have certain skill to deliver a certain service. And thirdly, we need to improve or increase our manufacturing capacity so that when the need for medicines arises, we are not dependent on others, as you have already seen that supply chain for vaccines, richer countries who have produced them have not necessarily easily given them to other countries. And if you do not have a local capacity for manufacturing, you suffer the most. So these are some of the three low-hanging fruits we can do something about in the coming 3 to 5 years.
Professor Colin Masimirembwa is our guest on Economic Forum, where we are discussing various issues about drugs or medicines that contribute to our economic development. So join us in the second segment of Economic Forum. Welcome to the second segment of Economic Forum, where we are discussing issues to do with the access to drugs and solutions that we can have in order to be able to heal different diseases that might come our way as a country. And we've invited a biochemical pharmacologist, that is Professor Colin Masimirembwa, who is with us here discussing all those possible solutions that is also working on together with his colleagues. If you would like to get in touch with us here on Economic Forum, you can do so on the numbers that are showing on your screen. And I would like to say we're very happy with the kind of feedback that you are giving to us. It's valuable feedback, and even the suggestions that you are making for some of the topics that we can discuss which are related to economic development. Thank you very much for all that. And back to Professor Masimirembwa. Professor, earlier on, you talked about the low-hanging fruits. You know, when they are low-hanging, it means let's grab them, let's make use of them. They're not difficult, to access. And you mentioned skilled manpower. That it is very important. But we have skilled manpower. You are going to be telling us why you think we should stress that point. And then from that, you also go to infrastructure as well as other issues. So let's start with skilled manpower. Are you saying that we don't have enough skilled manpower?
So actually we do not have enough skilled manpower, and the Ministry of Higher and Tertiary Education conducted a survey to see the skills deficit in the country, and you will notice that when they look at the medical area, it was way in the 90% deficit, in terms of the number of doctors we need, the number of pharmacists we need, medical laboratory technologists we need. So whilst they are well trained, they are just too few to be able to provide the services which are needed countrywide.
But while you are there, Prof, is the training adequate? So at times we can be trained but not gathering enough skills in our training. Are we happy with our curricula that we're using in training these medical personnel?
Well, the curriculum continues to evolve. And I think in the recent years, we have tried now to change it to adapt to the new developments, the new technologies. So, and I think that will allow us to do more than we have been doing before with our older training. And I think the Education 5.0 will address some of those aspects where we are demanding that our trainees, doctors, pharmacists, do not just memorize facts, but are thinking in terms of solutions. So innovation has come into play. And the idea of innovation is that we also produce products and services. And I think the ministry has really hammered this home quite strongly. But I think the challenge for us is not only the quality of the training, but the numbers. So I'm so happy that at least now there are probably up to 4 universities now we are going to be training medical doctors so that we can train enough for our needs. So I believe that the new curriculum through Education 5.0 will help us to moderate the quality. The number of universities which are now starting medical schools will also help us to increase the quantity without compromising the quality. And if we go now to the infrastructure, of course we have good hospitals in the big cities, the provincial hospitals, but thereafter, most of our population is in the rural areas. Just the access to a clinic or to a hospital is very difficult for most people. And I believe that more work needs to be done so that people who are scattered around the country are able to access these services. Because you can have very good services in Harare or Bulawayo, but the major part of our population is totally disadvantaged in the rural areas. So I think that aspect is also important. In terms of also specialized hospitals, we have sort of general hospitals. You will find most people are still going maybe to other countries for kidney transplants and different transplants. And I believe that our doctors should be able to do this kind of things.
And that has got a bearing on our economy.
Exactly.
If we access all that locally, yes, it then also assists us in our economic development. As you also rightly said about the provision of medicines, that even those who are donating, it's better to donate medicine from Zimbabwe than to bring it from abroad.
I mean, just to backtrack on the issue of specialized services. Now and then we have conducted quite outstanding surgeries in Zimbabwe, and I think that can be built on, and we can do more, including these kidney transplants and so forth. But going to the issue of medicines, I think last year the pharmaceutical sort of manufacturing strategy was launched, and the idea was how can we capacitate.
And that's part of NDS one.
Yes, it is. Yes. How can we have some of our private manufacturing companies improve their technologies to be able to manufacture the drugs that are needed in the country? How can we do the clinical studies that are required?
That are needed and that are appropriate.
Appropriate. So, I believe that this is something we can do because our companies have before done very well. There are some companies which were producing ARVs and we didn't have to get ARVs from outside. There are companies which were producing drugs for cardiovascular disease, but they're not producing anymore. And if these are capacitated to come back to production levels that can satisfy the country, that would be great. And that's where we also need policy that protects our companies. Because if outside companies are going to bring their products cheaper, they will always be cheaper than ours initially. Because the inputs into the bringing the industry to speed makes our products more expensive than those coming from other countries. So I believe that the government needs to protect the local industry for a certain period until they are competitive enough. So that, like you rightly say, when anyone tries to donate medicines, they do not donate from their own countries. Yes. Because by so doing, they are enriching their own economies. Yes. We want them to donate on products that are produced locally by our own companies.
But just a few words, Professor, about equipment. When you're talking about infrastructure, at times you are rushed to hospital and you are told that, there was no ventilator or there was no piece of equipment that is very critical in your healing. Just say something about appropriate technology.
So I think when it comes to equipping our hospitals, there are two sides to it. Procuring this equipment is very expensive. maintaining it even more expensive. So what we have suffered mostly is that we procure equipment and we have no service model to make sure that this equipment is working all the time. So sometimes you go to laboratories or to hospitals and you find that most of the equipment is not functioning. So I think we need to now develop a lot of technicians who can repair and service this equipment. And I think that emphasis in our polytechnics is very important so that we produce technicians and engineers who can, once we have procured the equipment, they can service it so that it can operate for longer periods. I think that's the main problem we are facing.
I'll stop you there for the time being. That's Professor Colin Masimirembwa. Professor Masimirembwa is a biochemical pharmacologist, and today he's talking about solutions to better access to health in Zimbabwe, coming up with a number of solutions that are being proffered, and also encouraging that we develop our skilled manpower in that area. So you'll join us in the third and final segment of Economic Forum. Welcome to the third and final segment of Economic Forum, where today we are discussing possible solutions to our health environment so that we're able to access different medicines here in Zimbabwe, and we also have skilled manpower and well-developed infrastructure. And we have our guest here, Professor Colin Masimirembwa, who is a biochemical pharmacologist, who himself is also very much involved into some of this research. Professor, let's look at long-term solutions, because you have been hammering on innovation, and it is very important that we continue to dig out in order to research in order to come up with some of these things. Let's go into that area, long-term investment into research and economic development with regards to our access to good health.
So thank you. So this is the area we are mostly working in, where a couple of years ago, we did a survey to see the capacity for drug discovery, development, and deployment on the African continent. And it is really sad to realize that of all the drugs you are buying in the pharmacies, the conventional medicines, there's not a single drug which was discovered and developed in Africa. All of them are from outside, which means there has been no pharmaceutical industry in Africa which has a capacity for R&D. And this is an area our institute has been working on to try to build capacity for research and development. And our institute has been trying to work in this particular area, looking for new molecules which can go and modulate aspects of disease so that health is either retained or recovered.
Prof, while we're there, you keep on saying you are working on that as your institute. How are you working with other national institutes so that we quickly go back to your point of developing our manpower? Are you also involving our local tertiary institutions so that there's rapidity in what you're saying?
Exactly, and true indeed. We cannot even do it by ourselves. So you will find that our institute works very closely with major universities in Zimbabwe. And we are also working with different government departments for them to understand the value of these, whatever discoveries that might come out, that the ownership of these solutions is a national one. Because ultimately we want to have a drug discovery and development industry in the country.
The other thing that is happening, Professor, is that because these drugs have become very expensive, people get prescriptions from their doctors, but they don't go to the pharmacy in order to purchase those drugs. They then look for alternatives, and they'll only come back and try to look for the funds when the situation of their health has become worse. Say something about that.
Well, the drugs are, especially in new drugs, are going to be expensive because whoever has come up with the drug has to recover the cost of discovering and developing it. But when they are generic drugs, they should be relatively cheaper. And I believe that the expense has to do with us not being able to manufacture them locally. That's number one. And we can control that somehow if the government, as it has sort of promised to capacitate the local manufacturing companies, I think in the short term we should see the prices going down. But secondly, we should have a sort of medical aid or system that can be accessed by many people.
Just a brief word about traditional medicine. You have not said much about it. Do you also look into it? You said even in Africa, we're not producing these drugs, but we were using traditional medicine. Is it something that you look at and say, I think for this disease, you're okay using this traditional medicine than writing it off altogether?
Well, I always prefer not to comment much on traditional medicine because my knowledge in that area is not much. The only areas I've interacted with people who are advocates for traditional medicines is, let's just test it for safety, because there are reports where it has been shown that some of the traditional medicines are associated with certain side effects to do with liver function, with kidney function, and so forth. So we have tried to use our platform, which evaluates compounds for safety, to just be able to assure those who are going to take traditional medicine that this traditional medicine, we have tested it for safety and it should be fine. Whether it's going to treat you or not, that's a story for other experts to comment on.
Yes. And the research that you are currently doing in 30 seconds?
So the research we are doing is to look at the genomic structure of African populations, because we have noted from the studies we have done on Nigerian, Kenyans and South Africans and Zimbabweans that our genomic structure is very unique, is very diverse.
Genomic meaning? Genomic
meaning that the information that determines who you are, which is coded by certain chemicals which have given the name DNA. And that DNA, it is the one which can tell us how best you are to treat a particular disease and how not to treat a particular disease, and what are the best targets for a drug. Our work over the past 10 years has shown us the genetics or the genome of African people is very unique, and it is an asset in terms of understanding how best to look for new drugs and new diagnostics. So using that approach, we have developed a genetic test called Genopharm, and this is now registered for use in patients. And this genetic test allows us to know how you're going to react to over 70 drugs. So if you have that test, we are able to tell which drug you should be given or should not be given, and if you're going to be given the drug, at what kind of dose. And this particular genetic test, we are now going to expand its use in Kenya and in Nigeria. So this is the kind of work we are doing, and we believe that the same applications...
Kenya, Nigeria, and Zimbabwe.
And Zimbabwe. Okay. Of course, it always has to start
in Zimbabwe. Yes. Well, on that note, Professor Colin Masimirembwa, I would like to thank you very much for coming on to Economic Forum, where we've been talking about access to drugs or medicines and its importance to our economic development, because we are over-reliant on drugs that are coming outside the country, and that has a bearing on our economy. Thank you very much for coming.
Thank you so much.
So until next time, remember to get in touch with us. As I said before, we're very happy with the feedback that you are giving us. The numbers are showing on your screen, and if you'd like to watch some of these episodes, you can do so on our YouTube channel, Economic Forum Zimbabwe. So until next time, on behalf of the production crew, this is John Masugu.